You may think that once you get into bed, your heart finally gets a break. But some of the things you do during the final hour of your day may be working against the very recovery your body needs overnight. Imagine this. It is the end of a long day. You finish dinner, turn off the lights, and climb into bed, believing your heart can finally relax. That feeling makes sense, but your heart never truly switches off. Throughout the night, it continues pumping blood, regulating circulation, and responding to changes in breathing, stress, temperature, and body position. After 50, those nighttime patterns deserve attention because blood pressure, sleep quality, medications, and other health factors can influence cardiovascular health. Let me make one thing clear. No single bedtime habit guarantees a heart attack or stroke. The real concern is a repeated pattern that may place unnecessary stress on the body or interfere with healthy sleep. Today, we will look at 4 common nighttime habits that deserve a closer look. Some may seem harmless, and one may even feel like a way to relax. But feeling relaxed is not always the same as giving your cardiovascular system the conditions it needs for recovery. Think of your heart like an engine that has worked all day. It keeps running while you sleep, but it benefits when everything around it becomes calmer and more predictable. That is why understanding healthy sleep comes first. When you fall asleep, your body enters a different operating mode. Your breathing usually becomes slower and more regular, your muscles relax, and your nervous system shifts toward a calmer state. For many people, blood pressure also falls during sleep. Doctors sometimes call this nighttime decline a dip. It is one reason good quality sleep matters beyond simply feeling rested the next morning. Your heart and blood vessels are still working, but the overall demand on the cardiovascular system can become lower. Now imagine the opposite. If your sleep is repeatedly interrupted, if you are stressed, uncomfortable, or struggling to breathe, your body may keep receiving signals that something needs attention. That can activate the nervous system and make your heart work harder than it should during a period intended for recovery. This does not mean one restless night is going to cause a cardiovascular emergency. Everyone has occasional poor sleep. The concern is a persistent pattern. Research has linked chronic sleep problems with conditions such as high blood pressure and other cardiovascular risk factors. Sleep also affects hormones involved in appetite, blood sugar, stress, and inflammation. Think of nighttime as a maintenance window. Your heart does not stop working, but your body has an opportunity to settle into a more stable rhythm. That is why the habits you repeat before bed matter. They can influence whether that transition happens smoothly or whether your body remains more activated than necessary. And the first habit we need to examine begins with something almost everyone does every day: eating. Specifically, eating a large meal and then going straight to bed. Understanding that nighttime process makes these habits easier to recognize. A heavy meal close to bedtime may seem harmless, especially if you have spent the day busy and dinner is finally the time when you can sit down and eat properly. But there is an important difference between eating an ordinary evening meal and regularly going to bed immediately after a very large one. Digestion requires work. Your stomach and intestines become active, and lying down soon after eating can make symptoms such as heartburn, fullness, or discomfort more likely in some people. If that discomfort wakes you repeatedly or makes your sleep lighter, your body may not get the restorative sleep it needs. There is another issue as well. Large meals can affect blood sugar and digestion differently depending on what you eat, how much you eat, and your individual health. This is particularly relevant if you already have diabetes, reflux, or another condition that makes late eating troublesome. The point is not that everyone must stop eating after a certain hour. There is no universal bedtime that magically turns food into a danger. Instead, pay attention to timing, portion size, and how your body responds. If you regularly finish a very large meal and lie down minutes later, try giving your body more time before getting into bed. A lighter evening meal may also be easier to digest. And notice what happens to your sleep afterward. Do you feel overly full? Do you wake with reflux? Do you sleep poorly? These clues can help you identify a routine that is working against you. But food is only part of the story. The next habit is even more interesting because many people use it intentionally. They believe it helps them relax before bed, yet it can interfere with the quality of sleep they actually receive. That distinction matters when choosing your evening routine. That habit is using alcohol as a nighttime sleep aid. You may know someone who says, "A drink helps me unwind," or perhaps you have noticed that alcohol makes you feel sleepy. There is some truth to the first part. Alcohol can make a person feel relaxed and may help them fall asleep faster. But falling asleep quickly is not the same thing as getting healthy, restorative sleep. As the night continues, Alcohol can change normal sleep patterns and contribute to awakenings or lighter sleep. For some people, it can also worsen snoring or breathing problems during sleep. That matters because repeated poor quality sleep is not simply a problem for your energy the next morning. Over time, sleep disruption can interact with blood pressure, stress regulation, weight, and other cardiovascular risk factors. This does not mean that one drink automatically puts your heart in danger, and it certainly does not mean every person who drinks occasionally will develop heart disease. The important question is whether alcohol has become your regular strategy for falling asleep. If you need it to relax every night, it may be worth discussing that pattern with your healthcare professional. You can also experiment with other ways to wind down, such as a quiet walk, reading, gentle stretching, or a consistent bedtime routine. The goal is not perfection. The goal is to help your body recognize that the day is ending without depending on something that may disturb sleep later. And this leads to a surprisingly common problem. Sometimes the issue is not what you eat or drink. It is that your brain never receives the message that the day is actually over. The goal is better sleep, not fear. Think about the last hour before you went to bed. Maybe you were answering messages, watching upsetting news, checking work, arguing with someone, scrolling through your phone, or worrying about tomorrow. Your body may be physically in bed, but your nervous system can still behave as if you need to stay alert. When we feel threatened, excited, worried, or intensely stimulated, the body releases signals that increase alertness. Heart rate and blood pressure can rise temporarily, muscles become more prepared for action, and falling asleep can become harder. That response is useful when you need to react to a real problem. It is less helpful when you are trying to enter deep, restful sleep. Screens can add another layer because bright light and stimulating content may make it harder for some people to settle into their normal sleep schedule. The solution does not have to be complicated. You do not need to throw your phone away or create a perfect wellness routine. Try creating a wind-down period before bed. Lower the lights, silence unnecessary notifications, move stressful conversations earlier when possible, and choose something calm. Reading a few pages, listening to quiet music, or simply sitting in a comfortable room can help create a clear boundary between daytime activity and nighttime rest. Think of your nervous system like a car after a long drive. Turning off the engine does not instantly cool every part of it. Your body may need a little time to slow down. And if you have been struggling with poor sleep despite making these changes, there is one more issue you should not simply blame on age. It involves something happening while you are asleep, often without you knowing it. And it matters. One of the most overlooked nighttime issues after 50 is persistent snoring combined with breathing interruptions. Snoring by itself does not automatically mean you have a serious condition, but loud, frequent snoring, gasping, choking sounds, witnessed pauses in breathing, morning headaches, or significant daytime sleepiness can sometimes point to sleep apnea. Sleep apnea means breathing repeatedly stops or becomes greatly reduced during sleep. When that happens, the body can briefly shift into an alert state to restore normal breathing. Imagine trying to repair a house every night while an alarm keeps going off. You might eventually get the job done, but the repeated interruptions make the process much less peaceful. Sleep apnea can fragment sleep and is associated with high blood pressure and increased cardiovascular risk. That does not mean every person with snoring has sleep apnea, nor does it mean a sleep disorder guarantees a heart attack or stroke. It means persistent symptoms deserve attention. This is especially important if a partner has noticed that you stop breathing, gasp, or suddenly snort awake. Some people assume they are simply poor sleepers or that tiredness is an unavoidable part of aging. That assumption can delay evaluation. If these symptoms are frequent, talk with a healthcare professional. Depending on your situation, they may recommend a sleep evaluation or testing. The good news is that sleep disorders can often be identified and managed. The bigger lesson is that not every nighttime problem should be ignored. Your body gives you information while you sleep, even when you are not consciously aware of it. And once you recognize that, you can start separating ordinary aging from warning signs that deserve medical attention. This repeated disruption can place extra demands on the body, which is one reason persistent symptoms should not simply be dismissed as normal aging. That does not mean every symptom is dangerous, but persistent breathing problems deserve attention, rather than being repeatedly dismissed as simply getting older without proper evaluation for years. Aging brings changes, but aging should not become an excuse to ignore new or unusual symptoms. There is a big difference between occasionally waking up tired and repeatedly experiencing symptoms that could signal a medical problem. Chest pressure, tightness, or discomfort deserves attention, especially when it is new, severe, or accompanied by shortness of breath, sweating, nausea, weakness, or pain that spreads to the arm, back, neck, or jaw. Heart attack symptoms can vary, and some people do not experience dramatic chest pain. Stroke warning signs also require immediate action. Sudden weakness or numbness, particularly on one side, trouble speaking, confusion, sudden vision changes, severe dizziness, or a sudden severe headache can be warning signs. If symptoms like these appear suddenly, do not wait to see whether they disappear. Seek emergency medical care. This is not about frightening you. It is about knowing the difference between prevention and an emergency. A healthy evening routine may support long-term cardiovascular health, but it cannot replace medical evaluation when warning signs appear. It is also important to remember that nighttime symptoms can have many causes. Reflux can cause chest discomfort, anxiety can cause a racing heart, and poor sleep can cause morning headaches. That is why self-diagnosis is risky. Pay attention to patterns and communicate them clearly to your healthcare professional. If something is new, persistent, worsening, or concerning, it deserves a conversation. The good news is that once you know what to watch for, you can stop treating every symptom as mysterious. You can respond thoughtfully instead of ignoring it. And that brings us to the practical part. What can you actually do tonight to create a calmer, more heart-friendly routine? The healthiest bedtime routine is usually not complicated. It is built around a few consistent habits that help your body transition from daytime activity into sleep. Start with your evening meal. If large meals leave you uncomfortable or cause reflux, consider eating earlier or choosing a lighter portion. Give yourself enough time to settle before lying down. Next, create a wind-down period. Even 30 minutes of calmer activity can create a useful boundary between a busy day and bedtime. Reduce unnecessary notifications, dim bright lights, and choose something that genuinely helps you relax. If you drink alcohol, be honest about what role it plays in your sleep routine. If you depend on it to fall asleep, talk with your healthcare professional rather than assuming it is harmless. Then look at your sleep itself. Are you consistently getting enough sleep? Are you waking repeatedly? Does someone tell you that you snore loudly or stop breathing? These patterns matter. Finally, take prescribed heart or blood pressure medications exactly as directed. Do not change timing, skip doses, or stop a medication because of something you heard online. Medication schedules are individualized. Your doctor or pharmacist can tell you what is appropriate for you. None of these changes is a magic shield against heart disease. Think of them as small pieces of a larger prevention strategy that may also include exercise, healthy nutrition, blood pressure control, cholesterol management, not smoking, and regular medical care. The goal is not to make bedtime stressful. It is to make bedtime calmer, more consistent, and more supportive of the health you are working to protect. That gives you a practical starting point without making bedtime feel complicated or stressful tonight. Before you turn out the light tonight, take a moment for a simple 5-minute check-in. Ask yourself whether you ate an unusually large meal right before bed and whether it tends to disturb your sleep. Think about whether alcohol has become your main way of relaxing at night. Notice whether your mind is still racing because of work, news, social media, or tomorrow's worries. Then consider the quality of your sleep. Are you waking repeatedly? Are you snoring loudly? Has anyone noticed gasping, choking, or pauses in your breathing? Finally, ask whether you have been ignoring a symptom simply because you assumed it was part of getting older. This is not a medical test, and it cannot tell you whether you have heart disease or sleep apnea. It is simply a way to notice patterns. Patterns are powerful because a single bad night may mean very little, while the same problem appearing night after night deserves a closer look. You do not have to change everything at once. Choose one habit you can improve and observe how your body responds. Small, consistent decisions can become meaningful parts of a broader approach to healthy aging. And when you put these habits together, one important message becomes clear. Use this check to notice patterns, not to diagnose yourself or replace professional medical advice. Your heart does not need you to have a perfect bedtime routine. It needs you to pay attention to the basics and recognize when something is not right. A very heavy meal immediately before bed may interfere with comfort and sleep. Alcohol can make you feel sleepy while still disrupting restorative sleep. Late-night stress and stimulation can keep your nervous system more active than you realize. And persistent snoring or breathing interruptions may deserve medical evaluation rather than being dismissed as normal aging. Most importantly, symptoms such as sudden chest discomfort, severe shortness of breath, or possible stroke warning signs should be treated as emergencies. The goal of this conversation is not to make you afraid of bedtime. It is to help you understand that nighttime health is part of cardiovascular health. When you improve sleep, pay attention to warning signs, follow your treatment plan, and make practical lifestyle choices, you give your body a better foundation for healthy aging. And there is one final thought I want you to remember before we finish. These small changes can support better sleep. You do not have to overhaul your entire life tonight. Start with one change. Maybe you will give yourself more time between a heavy dinner and bedtime. Maybe you will create 30 quiet minutes without stressful screens. Maybe you will stop using alcohol as your automatic sleep solution. Or maybe you will finally mention persistent snoring or nighttime breathing problems to your doctor. The important thing is to stop assuming that every problem is simply part of getting older. Your body continues to communicate with you, and paying attention to those signals is one of the most practical forms of prevention. If this information helped you, share it with someone over 50 who might benefit from hearing it. And if you have a nighttime symptom that concerns you, remember that a healthcare professional can help you understand what is actually happening in your specific situation. Educational videos can give you questions to ask, but they cannot replace personalized medical care. Take care of your heart, protect your sleep, and remember that small decisions repeated consistently can support healthier years ahead. One thoughtful change tonight can begin a healthier nighttime pattern for your heart and health.